Is that working? Can everyone see it?
That's
Great.
perfect.
Okay. So I'll get started. Good morning. Thank you so much for joining us today. We're really excited to talk to you and see if we can clarify some of your questions. I know that we received some questions ahead of time, so we have prepared a presentation just to address those questions. Thank you so much for submitting them. And hopefully, even if they don't answer all of your questions, at the end we'll have time for more questions, or you can feel free to start typing things in or during the conversation, or just like unmute yourselves, and it's okay to interrupt us to clarify or ask more questions. That's what we're here for. Okay. So as we know, COVID-19 or coronavirus has been present for a couple of years now. And things have changed since the beginning of the pandemic. So now we have vaccines available, and new variants have come up that are less severe in terms of the illness that they cause. Um, so just a little bit of an update in terms of what's going on with the variants right now. In New York State, right now, the most dominant variant is Omicron, and New York State ranked 12th among the states that were where coronavirus has been spreading the fastest. And this increase was interestingly seen after the mask mandate for schools was lifted. The most common variant, as I mentioned, is the Omicron, specifically BA.1 and BA.2. So BA.1 was the one that started back in December, when we had that significant surge in the number of cases. And BA.2 is the more recent one that has been making its way through the United States and taking over in terms of how many of the cases are due to it. For example, at the end of February, the CDC estimated that 100% of the samples in New York, New Jersey, Virgin Islands, and Puerto Rico, they grouped them together, were Omicron. And last week, within New York State, there was an increase in the number of COVID cases, newly diagnosed COVID cases by 36%. It's important to keep in mind that obviously we still have a low total number of new cases. So this new spread is happening in the setting of low numbers. Specifically, there were last week 15,412 new cases, and the week before that there were 11,323 new cases. So as I mentioned, Omicron BA.1, the 2, is expected to become the dominant variant in the US. And so far in New York, it accounted for 39% of new cases last week, which is greater than before. It was in the low teens before that. Some interesting facts about it is that it is less well inhibited by the selected monoclonal antibodies that we use in adults for treatment. But we are trying to come up with new antibodies and new treatments to specifically target the Omicron variants. And those who had the Omicron BA.1 in December do not have a high risk of reinfection. So obviously, now that things are turning a corner, the variants are cause less severe illness, and things are going a little bit more back to normal. The mask mandates have been lifted. Why should we be getting vaccinated? There are many concerns in our parents, amongst ourselves, in terms of like, is it safe? Is it even really necessary at this point? So we're just gonna go through some facts with you, so that you can better gauge whether or not it is something that you want to do. As pediatricians, we definitely recommend that all the children who are able to get vaccinated. And these are the reasons why. So children ages 5 through 11 years old are at risk of getting very sick from COVID-19. there have been nearly 2 million cases of COVID-19 in children in this age group in the US. And as of October of 2021, right before the Omicron surge in December, children in this age group experienced more than 8,300 COVID-19 related hospitalizations, and there were nearly 100 deaths from COVID-19. Children in other age groups have also been affected. There were 347 and 731 COVID-19 related deaths in children ages 0 to 4 and 5 to 18 years old, respectively. So obviously, compared to adults, these are low numbers, but it's still our children and it's still important. COVID-19 ranks as one of the top 10 causes of death for children 5 to 11 years old. And hospitalization rates among children ages 4 and younger were 5 times higher during the peak of Omicron compared to the peak of Delta. So as you can see, while it may not be as severe as in adults, and many of the young children can be asymptomatic, it is still causing significant illness in our children and they need protection. So children can experience both short and long-term conditions after infection. One of the complications that is on the serious side is a multi-system inflammatory syndrome, or MACI, and that's a condition where you have inflammation throughout your body affecting different organs. And we have been seeing this in the hospital, and kids get really sick from it, and it's sad to see. Children who get infected can spread COVID-19. As I mentioned, some of the younger kids tend to have asymptomatic infections, and obviously this puts other people at risk, especially if family members are immunocompromised, or family members are not able to get the vaccine at this point, like younger children. This is important to keep in mind. So vaccination would be a key way of protecting others in addition to the children who are actually getting vaccinated. And this is especially important now that children are back in school, participating in sports, play dates, and other group activities. Should we get vaccinated if we already had an infection? The answer is yes. The purpose of the vaccine is to protect from severe illness and hospitalization. And as I mentioned earlier, children do experience hospitalization and some of them die from COVID-19. So getting them vaccinated is key in protecting them. The COVID-19 vaccine causes more predictable immune response. This is what protects you from infection and from illness by the virus compared to a natural infection with the coronavirus. The level of protection people get from having coronavirus infection depends on how mild or severe the illness was, the time since the infection, so how long ago they had COVID infection, and their age. COVID-19 vaccines give most people a high level of protection against COVID-19 and can provide added protection for people who already had COVID-19. For example, people who already had COVID-19, those who did not get vaccinated after their recovery are 2 times more likely to get COVID-19 again compared to those who get fully vaccinated after recovery. So it is worthwhile. Of course, as with any medication, any treatment, we worry about the safety, especially with our children. We want to make sure we're doing everything to protect them and whatever is best for them. So the answer to this question is yes, vaccines are safe, and especially the COVID vaccine is safe. The serious health events that have been reported after COVID-19 vaccination are rare, and I'll just go through some of them. So there's a risk of myocarditis, which is inflammation of the heart, and pericarditis, which is inflammation of the tissue, the outer lining of the heart. And this is more common in teenagers and children 12 to 17 years old after the Pfizer vaccine, which is the only one that's approved in this age range at this time. But these reactions are rare. So far, there have been reported 54 cases per million doses administered to males ages in this age group. And it is important to note that all of these children have recovered completely. There's no long-term effects noted so far. And there have been no cases reported in the clinical trials for children 5 to 11 years old when they were testing the vaccines. The risk of developing myocarditis from an actual COVID-19 or coronavirus infection is higher than the risk of developing it from the vaccine. So that's also something to keep in mind. There's a risk of getting myocarditis if you get COVID. So having the vaccine can also protect you against that because you have a lower chance of getting the illness. I know, especially at the beginning in the news, we were seeing some people were having severe allergic reactions after the vaccine, including anaphylaxis. And while this may happen after any vaccine, it is rare. So far, there have been 5 per 1 million vaccinated people in the US developing anaphylaxis. Other important things to note is that you cannot get COVID-19 from the vaccines, and there is no evidence that COVID-19 causes fertility problems in either males or females, which I know is not necessarily something that is essential for children, but it's something that I know as parents we may think of for their future. So what are some side effects that are more common after the vaccine and what to expect after the vaccine? Like with any vaccine, you can have pain, redness, and swelling at the site of administration. You can feel tired, have headaches, muscle pain, develop chills and fever, nausea. Typically, you develop these side effects within 12 hours and they disappear within 24 hours, which is reassuring.
Thank you, Adriana. My name is Jessica. I'm one of the residents as well. So it's nice meeting you all. Thank you guys for joining us today to talk a little bit about how COVID and how it affects children. And my part that we're going to talk about right now is just some of the long-term effects of COVID. So this doesn't happen to every child who gets COVID. This actually, the incidence found in Europe was about like 25%. There haven't been studies in America that shows an accurate number, just because only a fraction of children with long COVID, what we call long COVID, seek medical attention. So it's been harder to find what the incident in the US is. So what is it? So essentially, this term long COVID is a broad, just a general term that talks about just symptoms that children can experience even after COVID, after contracting COVID. Some of the symptoms that they might get could be a brain fog. They can have like some trouble concentrating. They can have some decreased stamina, especially in like athletic activities. They can have some pain, whether it's like a headache or joint pain. Some complain of fatigue. Some may complain of anxiety or depression, or a continuous cough or difficulty breathing. Some children might have some sleep problems. So generally, so this is still being studied right now, but the general hypothesis of why this is happening is because there's a continued, children don't clear the virus as they take a longer time clearing the virus than an adult. So they think that that could be a reason why children have these long-term effects. And there could be a continued exposure to those, what we call antigens, is essentially what's on the virus itself. It doesn't mean that they have, it's like a remnant of the virus. So it doesn't mean that the virus is replicating or anything like that. It just means that there's like little parts of the virus that triggers this immune response. So it's continued inflammatory state. So there's an inflammation happening. Um, some people have thought that maybe treating with anti-inflammatory medication like NSAIDs, like Motrin, may help. There's no actual studies proving that just yet, but I think they're still working on that. Right now, um, the the best treatment for if your child has these long-term effects, any of this, is treating the actual symptom that they have. Um, so if they have chest pain and they're not able to have um, have their physical conditioning is not the same, we would say go to see a cardiologist and they can run several exams. If that's fine, they can recommend that your child goes to like a physical therapist. If they have some cognitive difficulties, they can go see a neurologist. If they see they have depression, they can see a psychiatrist. So the most effective way of treating this is just um, kind of basing it off the symptoms that the child has. So if they have pain, they might need to see a rheumatologist. And this way we can work on that while we're getting more and more research being done, as this is as coronavirus is still only been around for around 2 years right now, this type of COVID variant. Um, so that's a little bit about the long-term effects. And this doesn't happen to all kids. Like I was saying, these are some kids. We have seen it more commonly happening in adults, but children can also experience these symptoms. So just be on the lookout if your child has had COVID, just to be on the lookout if they are presenting with any of these symptoms, and go talk to your pediatrician about that. Next slide, please. Adriana, could you click? Okay, so mass and child development. So I think there was something on the news where some people were talking about like, oh, masks can cause children to not develop the way that they should, and they can cause developmental delays. And if they go to certain early intervention or anything like that, it because of masks, that they're not able to get the help that they need. So there is no known evidence for that. So I know there's a concern because I know we've been we tell our patients learning to communicate for a child requires them to watch faces, mouth, and expressions. But this can actually happen even if there's a mask on the face. Um, it's actually shown that visually impaired children, those who cannot see, actually develop speech and language skills at the same rate as their peers. So even though I can see why parents can be concerned. Oh, like if people are wearing masks all the time, my child might not learn how to speak as quickly or learn or reach all their milestones. But your child will use other clues to learn and understand language. So they pay attention to like the little things that we might not even think about, the gestures that we have, the tones of voice. Our eyes are also conveying emotion, the way that we're listening. So these all play a factor, and they can see that and learn language. Um, so the best way to if there is a concern about, oh, just making sure that your child gets the necessary exposure to language, to watching faces and mouths, just make sure that your child has dedicated times at home where there's family around during their bath time or dinner time, without any sort of interruption. Then you can give those times to be dedicated to teaching your child, um, yeah, and communicating with your child. And then if you are wearing a mask outside, or if someone else is wearing a mask outside and you want to be able to engage with your little baby, um, just get the child's attention before talking and make sure there's nothing blocking your face. Just speak slowly and slightly loudly. Use hands, use body language, change the tone of your voice. Um, and if the baby's old enough, you can ask them if they understand what you're saying. Um, and you can repeat certain words and just reduce the distraction around it. And so these are all better ways to communicate with your child with while wearing a mask. Like I was saying again, and I want to emphasize, there is no known evidence that the use of face masks interferes with any sort of speech or language development. Research is still happening right now, so I mean, um, you can always talk to your pediatrician as this more and more research comes on this. Next slide. Oh, I guess the other slide on obesity is later, so we'll talk about that later.
Hi, so I'm just going to be talking about the types of masks and respirators. Again, we would just like to say that we would suggest any child above the age of 2 still continue to wear masks, even given the New York City mandate. And we know there are questions about which mask is the best mask for you. Masks in general are made to contain the droplets and the particles you make when you cough or when you breathe or when you sneeze. So it's protection for you when you sneeze, or protection from the outside if anyone is sneezing around you. In general, for adults, the best type of mask is a respirator, which is commonly known as the N95 or the KN95. But the most important thing for masks and children specifically is to make sure that you have a mask that fits you well. It should not be a loosely woven cloth that you can see through. It should be well fitted to your face, and it should have at least 3 layers of protection. Next slide. So in terms of cloth mask versus disposable mask, cloth mask, again, should at least be properly fitted to your nose and mouth and chin, should have multiple layers of fabric in between, should have the nose wire in order so that you can properly fit the mask to your face. And the fabric itself should be able to block light in front of it. That's how you know how that it is a thick enough material to be on your child's face. There should be no gaps in between the face mask when the mask is on your child, and it should not have any of those vents or exhalation valves on the mask. Same with disposable masks, though these ones are more widely available, are more one-time use masks. Again, we suggest that they should have a proper fit. They have multiple layers of material between them. And again, no gaps or sides in the face. Specifically with the disposable masks, you can tie the fabric ear loops in the back of your child's ear to make sure that the fit is good for your child. For both of these masks, we do suggest that you dispose of the mask after it gets wet or dirty, because that would decrease the effectiveness of the mask. Next slide. So this is just about N95s. Specifically, N95s are not suggested for children. They are more effective in adult use because they have not been tested in children. They have not been made to fit children's faces. In general, it is the best way to protect particles, but we do suggest you specifically as parents determine whether or not you feel the need to use an N95, as it does provide the highest level of protection, but it is also more effective when it fits your face properly. So there are some times where you would need to make sure that the fit is very good for these N95s. Next. So we do suggest that anyone over the ages of 2 who is not vaccinated or vaccines are not up to date, that they should continue to wear masks in indoor public spaces. But even those who are vaccinated, in areas of substantial high transmission of COVID-19, for example, schools or very public areas, we do still suggest that you wear masks as well. Currently, the CDC in general recommends a universal indoor masking policy for teachers, staff, and students in kindergarten to 12th grade, regardless of vaccination status, because this benefits all mask wearers in schools and make sure that the protection overall is beneficial for all. Again, although respirators are available in smaller sizes, they've only really been tested in adults, so they have not been tested in children, and therefore we're not exactly sure how effective the respirator will be in fitting to your child's face or protecting them. In general, the best advice we have for masks is to make sure that the mask is a well-fitting and comfortable mask for your child. The fit is the most important thing. Make sure that it fits over your child's nose and under their chin, does not impair their vision, and they're able to breathe properly. Some masks and some respirators may feel different for your child, so it's really up to your preference whether you would want to wear a cloth mask or a disposable mask for your child. Next. Okay. Adrian. Yeah, so that concludes our presentation. We can take any questions that you have.
One more. Sorry to bother you, Adina. I realized we skipped a slide earlier, so I just wanted to go over that, and then we will go over questions really quickly, just in case this might be one of them. So like I was saying, obesity and COVID, I think that was one of the questions that were given to us, how obesity is affected or affects COVID-19 and the severity of symptoms. So a couple stats about that. As we all know, we gained our COVID-19 weight. I think a lot of us have gained weight throughout the pandemic. So it actually was shown that in children, and actually body mass index, the BMI, that's what we usually measure. You've been told about that. There's like a healthy weight that the child should be. So it seems that this BMI has actually doubled during COVID, during the pandemic, and it's more pronounced, and it was more pronounced in children who were overweight or obese and younger weight children. So that has been the trend during the pandemic. And this is a little concerning just because studies have shown that children with obesity can have worse outcomes from COVID. It's actually shown that those children who are obese are about 3 times, they have an increased 3 times higher risk of hospitalization, and 1.5 times, about 1.5 times higher risk of severe illness with hospitalization that can require intensive care, intubation. The reasoning behind this, so there's a couple of different thoughts about this, why this could be. So obesity, when a child is obese, they have fat cells that are enlarged and it becomes dysfunctional. And so it produces these inflammatory molecules. So just the child has like a chronic inflammatory state. And that paired with COVID, which produces like which induces an exaggerated inflammatory reaction. Those two together can cause so much inflammation that can damage the immune, cardiovascular, and respiratory systems. So that's why there is like the higher risk for children with obesity, because not only is COVID causing that elevated inflammatory state, they also have a baseline chronic inflammation. And then it's also in terms of their breathing, sometimes children with obesity have something that we call obstructive sleep apnea, which at nighttime they'll have like pauses when they like have moments where they are not breathing, and because due to just obesity causing like inappropriate, it can sometimes cause the chest wall not to expand as well. And so these two together can cause impaired respiratory function. So that means it may be harder for obese kids to breathe, and they might need to require a ventilator if at times if it's severe enough. Um, so really the best way to go about just preventing a child for even being at risk of this is just to get them back into a healthy body weight. So there's a lot of factors that go into this. It could be behavior. If your child is like sitting around all the time playing video games or watching TV, that can promote like a sedentary lifestyle where they're not moving as much as they should do. At least children are recommended to have at least like an hour of physical of activity a day. Just encouraging your child to be active, whether it's like doing something that they like doing. So if it's like playing basketball, or if it's like going on walks as a family, so you can have, it could be a group activity as well. And sometimes obesity can be due to genetic factors, but oftentimes, most times it's due to just behavior. If children are eating too large of a portion size, or if they're eating sugary foods or fatty foods, or carbohydrate rich foods, that can put them at risk of increasing weight. So just talking to your pediatrician, and if you need to see nutritionists to work on a plan for your child. If your child has struggles, has an increased weight, you can talk about how you can improve their diet, whether it's eliminating any sugary drinks, eliminating any junk food, snacks, and incorporating more vegetables. Those are some ways, but you can definitely talk with your pediatrician to come up with a better plan if that's an area of concern. Um, and of course, not only is obesity something that we get concerned about with COVID, children with obesity can develop pre-diabetes. They can develop a high blood pressure. They can develop that sleep apnea, and then fatty liver disease. There's so many different things that they can be at develop or be at higher risk for later on in life. So we always recommend, while they're still young and while parents are essentially able to control what they're eating, uh, just to have a greater influence on that. So just making sure that your child has better outcomes. And so that's a little bit about obesity and COVID. And like Dr. Dil Mohammed was saying, we are willing to take any of your questions, any and all of your questions. So please go ahead and ask away.